spirituality and health. I'm Dr. Rick Saguil. I used to have a practice in the area, family practice, sports medicine. 2005, it was about for 10 years. 2005, I left the area just to find myself and find out a couple more things, and wound up coming back about a year and a half ago. Don't have a practice. I'm in the emergency room, but we'll see what happens in the next couple of years. I'm sure I'll be developing something. But in the meantime, I really have this urge to teach other people what they probably should be getting from their doctors anyway. I think doctors are just too pressed for time, and they sometimes will refer out and won't have enough, I guess, good networking to get the education that patients need to stay healthy, stay out of the office. So hopefully this little thing will give you some enlightenment as to why you're doing what you're doing. I'm probably preaching to the choir, so if anything, it'll just give reinforcement that you're doing the right thing. So, spirituality and health. We usually have to have a disclosure in the beginning. My disclosure is that I am one with the universe. So, this is hopefully enough to, with the next couple of minutes, or next 20 minutes, to use you to figure out how to use this, and this to attain this, happiness, health. And obviously, because I'm doing nutrition, sports medicine, I always have to include nutrition, exercise, which is a big key in it, to get to this part. And possibly you can extend past that to other parts, or happiness. And that can even extend to our pets that we have at home. That is funny. This dog is actually, he's not the alpha dog, but you can see he's smiling. It's probably digitally enhanced. But there's a, anybody knows Cesar Millan, the dog whisperer? Yeah, he says that there's more unhappy dogs or pets in the United States for some reason. He says there's happier pets in Mexico. Sometimes if you get the Mexican and American dogs together, the American dogs get happier.
Because in other cultures, I think they love their spirit more than we do here.
Oh, definitely.
We don't pay attention to our spirit.
No question. It's terrible, and that's what we'll probably hit on. You hit it on the money. That's what we'll probably hit on here, hopefully, that we're missing something.
Because the happiness that you show the couple, it's like we have to look for happiness within before we can share it with somebody.
Right.
So.
Unfortunately, we're probably only a small population.
Yes.
Being one of the most powerful forces in the world, on Earth, for producing surgeries that will cure anything, or fix anything, not necessarily get you back to health, but fix anything, replace anything, take anything out, chemos, that will be so exact. They'll get it down to 2 millimeters, or radiation. But then, where does it all go? So, good point. Good pickup. And obviously this is an enigma, but some people like shortcuts, and that's not the way to go. So I guess to start out the definition, this is a Wikipedia definition. Second sentence made it. Sense of connection is central of spirituality. Connection to reality beyond than the physical world in oneself, which may include emotional experience of awe and reverence. There's always different definitions. You can get deeper into stuff with philosophy, ethics. I'm studying with Deepak Chopra now, and he does a lot of quantum spirituality. And if you listen initially, when I was listening, it took me so hard, so much concentration to just listen through his verbiage. But after a while, if you sit there, get all the distractions out, actually it's meditating too. You get the distractions out, just concentrate and relax, not worry about where's he going with this, or who's Einstein. You actually pick up some of this stuff. And it makes a lot of sense. But sometimes it's too much, and it takes us away. So I usually say just stop, keep it simple, stupid, and still the mind, or personalize it. And everybody has their own way of doing that. Hopefully when you adapt it to your own way, you can actually get the healing process. My personal way of introducing folks, because in Wheaton it's mostly Catholic or Christian, but I still had my other folks that were non-denomination or Hebrew. So I had to do a neutral way of approaching it back when I was here. If you think about what spirit comes from, it comes from the Latin word spiritus, which means breath. Conspiracy is all of us breathing at the same time. It's not just John JFK. So what I usually try to take it this way. A non-offensive way in the office, and I would usually introduce it with acupuncture. When I was doing my sports medicine, I got kind of bored with it. I was getting patients taken care of, diagnosing issues with backs or knees, and then I'd write it up, get it mostly from the history, and then send them off to physical therapy. And it would take at least a week to 10 days to get them into physical therapy. And in the real world, a week to 10 days from a kid in high school, that's one game, that's a week out of school, elevator pass all week, or a week out of work, that's half a paycheck for a week. So I really wanted to speed things up. And I didn't like the system, so I went to UCLA and did the acupuncture. And it worked great. I got people not even to the point that we didn't have to get to physical therapy, but didn't make money, and building was a nightmare, so I was told not to do it. Or in so many words, I was told we can do other things. So that was one of my legs of departure from the system. But when I would do it, I would usually instinctively tell my patients, okay, first couple of needles, when I'm having you wait 5 minutes, 10 minutes, let's do some breathing exercises. The lights were usually dim. Did I ever do acupuncture, you, John?
Yes.
Maureen? I think at that point I was kind of a real beginner to it, but I got to the point where I like to introduce a nice calm atmosphere, and then the lights, at least this is how I did in Florida, and then try to introduce breathing techniques. And I would have good results, and after a while, it's kind of unusual, but I didn't know whether it was the breathing techniques that got my patients better or the acupuncture needles. Just in the last couple of months, I've done some studies up in Boston, and I think the power of meditation is very powerful. That's why I got to this conference, or just to put this together, because there's so much strength in the spirituality or the meditation part of healing that I think we skip over it as docs, and boy, I don't even have to give pills anymore in most cases. As a little analogy, I've had a couple in the last couple months that came in with anaphylaxis, bee stings, especially in the last 2 months because of all the outdoor events. One kid was bitten by a tiny bug, and he didn't have any allergies. He just had an issue with drugs, but he had an EpiPen, a little injectable thing that you auto-inject when you have an allergic reaction. And he came in short of breath, high blood pressure, all red in the face off of his baseball game. And you can tell he's panicked. Typical fight or flight response. So the first thing I was supposed to do was to give him a hit of steroids, give him a hit of diphenhydramine or Benadryl, and then a stomach medicine, Pepsid. But I said, we don't have any allergies here, so let's just see what happens. So I told him to calm down. I did a breathing technique with him. All the nurses were saying, hey, we're ready. But just in case, and that's what emergency rooms are built for, I did a breathing technique with him. Turned down the lights, and I had to tailor-make it, just like I said, personalize it before. Because he wasn't buying it. He's a 15-year-old kid. He wasn't buying the, okay, let's go through the clouds, let's do mindful meditation. So I told him, okay, let's change this. Let's say that you're up to bat, you got a tough as nails pitcher, and I want you to go through a swing in slow motion. I told him to walk through that every second of the, just do the slow motion breathing. And there's different types of breathing. There's pranayama with yoga, there's Tai Chi breathing, there's abdominal breathing, sometimes you can associate with Pilates. But I like 4-7-8 breathing with Andrew Weil. And I'll show you what it is. But I was walking him through it, and you know what? He didn't need a shot. The swelling in his arm went down. He actually wanted to do more of the meditative walkfulness in the batting. I told him, I want you to hit 10 attempts, hit him out of the park, and then I want you to repeat it every 5 minutes. And he kept on doing it. I came back in 15 minutes, he was still like this. And actually did this, I don't know, he was trying to mimic that.
About 700.
You know, his dad he said it was a 500 batter, so I'm sure he's going to be all-state in 2 years, but he actually was doing great. I did it again with another lady, which she was definitely allergic to bees, and she was stung by a bee. And she did the epidural where she came in, and he had eyes that were fat, and she was a little short of breath. And there I was a little hesitant, and they already gave her 2 Benadryls in the waiting in the triage area, but we tried the same thing, and she was okay otherwise. Vital signs were great, so we tried a little bit of breathing. I gave her some cold compresses, and turned on the lights, did the same thing, and she actually, vital signs, blood pressure, heart rate, all came down. She wasn't so short of breath. Tongue wasn't that fat. She had a little bit of puffiness. But after about half an hour, she wasn't changing too much. She was happy. She was doing her meditative walkfulness.